We're going to look at what are the common pitfalls that GP trainees face when they're sitting the exam. The first thing is poor time management. So poor use of time is a common pitfall that lead to failure. It's something that a lot of GP trainees struggle, and we're going to look at how you can tackle that. The second one is lack of confidence. So you might feel that you're not confident at doing something. This can affect your performance and the way you talk and tone of voice. So it's important that you're aware of that. The last one is poor listening skill. So this is a problem that when GP trainees are asking questions, they don't really actively listen and or engage in the consultation. They're so preoccupied and think about what to ask next that the patient is telling them the story and answering the question, but it's not getting registered. The GP trainee might ask again later, same question or be repetitive. So these are common pitfalls to watch out and avoid. When you're learning a skill, it's important that you're aware of the 4 levels of competence. The first level is unconscious incompetence. So this is when you might not be aware that you're not good at doing something, and this is something that might need to be pointed out by somebody else. So that's why it's important to have somebody else to review your consultation so that they can identify what are your shortcomings, what are your blind spots. Then you can become aware of that. So this is the next level where you're consciously incompetent. So you're aware that there's something not right, but you're still not competent at doing it. The third level is when you're conscious and competent. So you're aware what you need to do and you're competent at it. And the next level above that is unconscious competence. So this is when you're actually competent and you don't need to be conscious about it, because now that you've done it so many times, it has become as a second nature. So you have an intuition. If you are feeling you're not confident right now, then you need to know whereabout are you at that stage. Because if you're at the level of consciously incompetent, it is natural not to be confident because you need to get to the level of competence. So that's important to know. Now, you might find that some people are very confident, but if somebody is confident and they're at level 1 where they're unconsciously incompetent, this is because they don't know what they don't know, then they're overconfident, and this is dangerous. So being overconfident is not good neither. To get better and improve your consultation, it's important that you go through this cycle as many times as you can and as fast as you can. By going through this cycle where you're consulting, you're assessing and evaluating your consultation, seeking feedback from somebody else to let you know what is it that you need to change and get somebody else's perspective, then you adjust what you're doing and implement that in the next consultation to improve it. So for example, if you're improving just by 1% every day, by the time for the exam, you'll be to the level where you have made a lot of progress. So the compounding effect by 1% every day is going to work in your advantage. So it's about being consistent and improving and refining it. Keep refining this. What are the problems that GP trainees face? So it's ineffective use of time. Ineffective use of time could be due to inadequate priming. If you're not priming your case sufficiently and adequately, then you'll find that when you're in the consultation, you're having to think it through, and because this is the first time you're thinking what to ask, how do I go about this, it's going to be more time consuming. Whereas if you've done it before the consultation, thought through the differentials, thought through how you're going to manage this, then it's going to run more smoothly. Organization is another issue. So if your history is not organized, you're going all over the place and going back and forth, that's going to take you longer to take a concise history. So it's important that you have some structure in your consultation. Another big one is poor use of questions. So many times I say GP trainees ask repetitive questions, or they're asking questions that's circling around. You want to ask questions that progress the consultation. You don't want to ask a question that's only going to dwell in data gathering. So it's important that you refine the quality of your question because that will determine the quality of the history you're taking. And to take a targeted history, it's critical that you're asking pointed questions that progress the consultation. The next one is overuse of summary. Sometimes GP trainee summarize excessively. So if you're summarizing excessively, then what happens is that you're doing more talking than listening in data gathering. In data gathering, you want to collect information and let the patient talk. But if you're doing a lot of summary, then you're not giving the patient time to talk. The next one is long-winded explanation. So explanation that are very long-winded, that takes a long time to explain something, is going to take a lot of your time and you won't be able to manage a consultation within time. And the next problem is that that's going to affect your clinical management and you're having to rush your clinical management. So be aware of the problem that's causing you to have an ineffective use of time. And to be able to tackle this problem, it's so important that you keep track of your time. This sounds basic, but if you don't keep track of your time, it's going to be difficult for you to measure where you're at in the consultation and allocate yourself enough time. So you want to keep an eye on the clock so that you know where you're at. The second point is to prime your case. Make sure that you give yourself enough time priming your case. Look at the relevant information in the patient's note. Think about what you need to consider. Think about what management you need to discuss, what treatment you might need to advise, and are you aware of the dose? So make sure that you're aware about how you're going to discuss that. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. It's important that you sharpen the quality of your question, because if you're asking pointed question, then you will progress your consultation. It's also important to know when to ask open-ended question and when to ask closed question. If you're asking closed question too soon in the consultation, it's going to be more time consuming to take the history, because you'll have to ask a lot of closed-ended questions to get the information. Whereas if you ask a couple of open-ended questions and encourage the patient to tell you the story, then you'll get more information in the first couple of minutes. The next point is active listening. So many people think that listening is passive and they don't do a good job at active listening. So active listening is being engaged in the consultation, giving the patient your attention and listening so that you can understand where this patient is coming from, and you can see what the patient is telling you and how they're telling it to you, because there are other verbal cues, non-verbal cues that you can pick up. The next point is to increase your pace. If you find that your consultation is slow, then you might need to compel yourself to consult possibly within 10 minutes to start with, and that will compel you to increase your pace. And then when you go back to 12 minutes, you'll find that it's easier to consult within 12 minutes. So by putting that constraint on yourself, you're going to increase your pace. And then when you remove that constraint, then you can consult within 12 minutes more easily. The last one is to make sure that you're allocating sufficient time for clinical management. To be able to score well, it's important that you give yourself ample time to discuss a management plan. So these are really important that you make sure that you're doing so that you're using your time more effectively. Some GP trainees feel like they don't know when to ask idea, concern, expectation, and when to ask the psychosocial. It's important to point out that the idea, concern, expectation can be asked at any time in the data gathering. The earlier the better, because when you know what's in the patient's mind, then you're going to have a better idea how this consultation might go. So if the patient has been telling you about the story, then you've learned a bit about the patient. Then it can be natural just to ask the patient, what were your thoughts about this problem then? then the patient will start telling you. And then you can ask the patient, was there anything that was worrying to you? So asking the eyes naturally in context is really important. Now, the psychosocial is something that you can ask afterwards. So for example, if the patient is coming with a headache, you can ask the patient, has this headache stopped you from doing anything? So you see, by linking the headache, the presenting complaint, to how has it impacted on the activities, then you're asking the question in context. So if you want to know more about their work, then you can ask, has this headache affected your work? So this is natural. You're not asking it in a formulaic way. If you find that you've asked psychosocial and then you're going to ask the red flags, you can do it that way as well. Ideally, you want to ask all the medical history at the same time, and then you ask the psychosocial. But sometimes it can overlap. So if it's vital, you need to ask a question. It's better to ask that question and going back to ask it, even if you might not be very organized. But for the safety of the assessment, you want to ask the question. So yeah, you can go back and ask it if it's vital for you to progress your consultation. Having a clear structure in your mind is important. So having a framework that you can go back to that will help you, especially if sometimes you may freeze during the consultation or you go blank, don't know what to do. By having a backup plan where you have a framework, you know exactly how this consultation need to go, then you'll be able to overcome that. So in the beginning, get the patient's story and then elicit the patient's health agenda, ask about the eyes. Then make sure that you're actively listening to what the patient is telling you. Then you might want to ask about the psychosocial. So how is this impacting on their life? How have they got any support at home? That will help you to know the severity and the nerve of the case. And make sure that you're covering the red flags to make a safe assessment. Once you've got the patient's eyes, you've got the psychosocial, and you can commit to working diagnosis, then you're good to progress and switch to clinical management. So in the clinical management, then it's important that you readdress what's the patient's concern or expectation, and make sure that your management is taking into account the patient's circumstance and unique situation. Because you don't want to make a plan that's just generic. You want to tailor it as much as possible to your patient's need and preference.
It's been my privilege as an examiner and more recently as a tutor on various exam preparation courses to hear the sorts of things that trainees are struggling with when they are finding this difficult. And I think in the early stages of learning how to consult, people can be over-taught. There can be too much instruction going on. Remember when you were learning to drive, the first few driving lessons, you were thinking, pressure on the wheel, which is the clutch, how do I change gear? Don't forget mirror signal maneuver, hands, all that stuff going on. The internal conversations you'll have with yourself, they actually get in the way. And it's really not until that internal noise dies down that you're free to direct your attention more outwards. And it's largely a question of familiarity.
If you enjoyed this short clip with Roger Neighbor, you might want to watch the whole video here. Click here to watch it. Thank you, everybody. Bye-bye.